of that guy on the left-hand side. That is my stepfather. His name is Pop. Will you get that music, Suzanne? So he's my bonus dad, stepfather. He's been in my life for about 30 years now, and he is an amazing man. He's a sweetheart of a man. He treats my mom like absolute gold, and he also has neuropathy. And a little bit about his history: when he was in high school and in college, his basketball jersey is retired at both his high school and his college. So he wasn't always infirmed and had issues with his balance and pain. You know, back in his day, he was actually a real stud. So, but it's sad to see now, because you see that little band on the back of his right leg. This picture is probably 5 or 6 years old. So now he actually has a shank that basically goes down the back of his leg into his shoe and helps him basically stay upright when he walks, because his balance is just getting so bad. And he was actually here visiting a couple weeks ago, and my son, as some of you guys know, I've got a 3-year-old son and I've got a 17-year-old daughter. So we're, like I say, we're doing diapers and dating. So we're all over the place. Keep us in your prayers. But my son was running around the office, kind of running up and down the hallway, and my stepfather wanted to play with him. He's kind of trying to chase him and interact with him as he zoomed by him, but he really could not because of his health, and particularly because of his neuropathy. So he's not really able to enjoy him and life and really everything that God called him to live and enjoy in life because of his physical health. So that's why we do what we do. And if we can't help him because he lives about 3 hours away and he can't really come here, you know, physically to get care, I guess he possibly could, but it's a long haul. But if we can't help him, then maybe we can help hundreds of people around this area with that same condition. So congrats on making the decision to be here. We ask you always to keep an open mind. A couple reasons for that is a lot of the data and the information we're going to cover, quite frankly, flies in the face of everything you've probably ever been told about neuropathy, and when it comes to how you can turn it around, or if there is even a potential to turn it around. So actually keep an open mind, and just so you know, everything that we do, all the techniques and the therapies, they're all backed in the literature. You can research them on PubMed. This is all, you know, well documented. We do it day by day in practice. So we're not just flying by the seat of our pants. It's a protocol that works. So by a show of hands, who's getting numbness? The numbness some people explain that as numbness, and other people call it like, feels like I've got a marshmallow underneath my foot, or my sock is kind of balled up underneath my foot, or I've got like a rubber band wrapped around it's like a tightness in the foot. Pins and needles, those are all essentially ways of describing numbness for a lot of people. The other one would be burning pain. So that can be burning like hot feet or cold feet. Anyone getting that? That's a pretty common one too. And then hand pain, because in a lot of cases of neuropathy, it'll start in the feet. More often than not, it starts in the feet, kind of works its way up the legs, and then at some point it'll start migrating into the fingertips, and then works its way into the arms, and then up into the torso. Back pain, that should be like everybody's hand goes up for that one. I think it's about 85% of Americans experience some sort of debilitating back pain at some point in their life, so it's literally epidemic. And then just generalized joint pain, so shoulders, hips, knees, elbows. We do have a lot of other options in terms of like PRP and stem cells and shockwave and laser therapy. So we treat a lot of people that have bad hips and bad knees and bad shoulders and just joint issues that don't really respond to the traditional medical cortisone, steroids, surgery, that kind of thing. So the goals of today, I want us to understand the challenging truth of what's considered to be the standard of care. What most of you guys have already experienced and gone through and been through firsthand, what could actually be causing the pain, because for a lot of people, they go to their medical doctor or they go to the neurologist and they're never quite told exactly what could be causing it. Like, just get the diagnosis, the prescription, and you're on your way. The documented dangers of actually having neuropathy long term, some of the proven methods for creating lasting relief, and then some simple steps we can take, some of them today, to get on the road to feeling better again. Sound good? Are you with me? All right, so we're seeing really a catastrophic increase. Concerning is not the right word. Almost every chronic disease that we worry about is really on a catastrophic uptick when it comes to what we face in the country. So things like diabetes, just diabetes alone in the last 60 years has gone up over 1,200%. Do you guys remember when we were kids, the two types of diabetes, what they used to be called?
Juvenile.
Yep. And adult onset. So they used to call it juvenile onset and adult onset diabetes. Well, they stopped doing that about 10 years ago because so many children were developing adult onset diabetes. The record was set about 5 years ago where a 3-year-old was diagnosed with adult onset or type 2 diabetes. So not only are we getting sicker and sicker as an adult population, but we're getting sicker and sicker at younger and younger ages. They're renaming diseases. That one disease alone, we spend more just on diabetes than we spend on our entire military budget combined. Homeland Security, Border Patrol, which I don't know how much we're spending there, Marines, Army, Navy, Air Force, we spend more just on diabetes than we do on our entire military budget. So that one condition alone is likely to bankrupt us. And type 2 diabetes is almost 100% preventable, regardless of what you've been told by other news or doctors or anybody else. It's almost 100% preventable because it did not even exist 200 years ago. There was no such thing as that condition really prior to the industrial age and all this agricultural farming and all the grain consumption and sugar consumption. And it's almost 80 to 90% reversible once you do have it. Raise your hand if you ever heard that diabetes is reversible. Some people have, some haven't, but a lot of people think it's just like a death sentence. Like once you get it, there's just no coming out of it. Heart disease, that one alone is going to kill about 1 million people in North America this year. Between the US and Canada, 1 million people will die this year from heart disease. Is that because they forgot to take their pills? No. They're going to take their pills for blood pressure and for cholesterol and for blood thinners, and they're going to die of heart disease anyway. So the problem is the system we have in place, which is mainly drugs and surgery, which is the standard American system, while it does have value, there's nothing about drugs and surgery that prevents you from needing drugs and surgery. Do you get that? So there's no prevention in that system. And again, like my sister's type 1 diabetic. So my sister's 6 years younger than me, diagnosed with type 1 diabetes. That's the insulin-dependent type. She's been taking injections since she was 4. If she didn't have her drugs, I wouldn't have a sister. So we all know circumstances where drugs can be life-saving, but in the whole, it's not moving the needle. The other one is neuropathy. Obviously, we've seen a major skyrocketing number of incidences, especially since COVID. And there's some speculation as to whether that's from the virus or it's from the vaccine or from the 7 vaccines people get with all the boosters. It's hard to know exactly, but at any rate, we're seeing a major increase lately from that condition. And then you can go down the line. Do you guys know what the #1 killer in the U.S. is? It's on there. Heart disease. The #2 killer is cancer. And they're estimating in about 5 years, cancer is probably going to surpass heart disease as the #1 killer. But you got heart disease and cancer. Do you know what the #3 cause of death is in the United States? What's that? It's iatrogenic cause, which means it's caused by the medical system. So the medical system is actually the #3 cause of death in the United States. And almost nobody knows that, nobody talks about that, nobody's aware of that. But the #3 cause of death is drugs and surgery. And then you can go down the line. Autoimmune diseases are going up, and fibromyalgia, and chronic fatigue, and digestive issues, and ulcerative colitis, and irritable bowel disease, and ADD, ADHD, and autism. Virtually every disease you can name is skyrocketing year by year. How much do you think we spend per year in the U.S. on health care?
Probably about $1 trillion.
Trillion? That's a good guess. You remember when $1 trillion used to sound like a lot of money? I remember when I was a kid, we were in New York City in Times Square where they have the debt ticker, the thing that runs that shows the national debt. It crossed $4 trillion that year, the entire national debt, when we were down there. And I was like, that's an incredible number of, like that, I couldn't even fathom that number. But we spend $4.5 trillion every year just on our health care. That is an astonishing amount of money. It's about 20% of our entire GDP. No other country comes close to that amount of spending per capita on what we call healthcare. And then if you look at the data too, we take about 75% of all the drugs produced on planet Earth. So we're spending $4.5 trillion, and we're taking 75% of all the pills made on the surface of planet Earth. And the question is, what are we getting for that result? That's the big question. So we're 4% of the world's population, and we're taking 75% of all the world's drugs. It's an unbelievable amount of money. Anyone wish they could take more medications? I've never had one person raise their hand and say, you know what, if I could take like 2 more pills per day, I think I would be healthy. Like, no one says that. Everybody wants to be on less and less drugs. But the reality is we're taking about 18, for seniors in the U.S., about 18 new prescriptions per person per year in the United States. 18. If you're put on a new blood pressure medication, you got to refill that every month. So that's 12 new prescriptions per person, or for that person for that year. A new cholesterol drug, a new blood thinner, a new fill in the blank. So we're guzzling drugs by the handful. The disturbing trend in modern medicine, that's the opioid crisis. Is anyone not aware of the opioid crisis? I think that's all of us that have heard of that, or our families have been touched by that. My family particularly has been really devastated by that. So 6 years ago in January was when my mother, my biological mother, not the one that's married to my stepdad, but my biological mother passed away from an opioid overdose 6 years ago in January. And then April was the 1-year anniversary of my little brother passing away from an opioid overdose. So that's hit my family as hard as probably just about anybody could imagine. And my little brother, he was working construction. He was climbing a ladder, doing his job. He fell off the ladder, shattered his ankle, and they had surgery, and then they gave him 60 Percocets with, I think, 3 or 4 or 5 refills. So, of course, by the end of that regimen of all those pills, he was fully addicted, which, by the way, it takes as little as 7 days for addiction to set in. Under the right circumstances, under the right biochemistry, you can take the medication for 7 days, and in some people, that's enough to start the wheels of addiction churning. And then, of course, his doctor cut him off because he realized he was addicted. He couldn't keep giving him the pills. So then he goes to the street, and now he's buying heroin and eventually fentanyl, and that's where that happens. So it's a real, this is not just like seniors taking too many blood pressure medications. I mean, this is literally devastating. We lose over 100,000 people every year just from drug overdoses. And a lot of it starts here with pain, with neuropathy, with knee pain. So part of our purpose in doing this is to keep people from going down that road, because that's a life of devastation. So it's interesting that we have in the U.S., we've got the most doctors per capita, or per patient. We have the most doctors. And I would argue we've got the best doctors here anywhere on planet Earth. When the Prime Minister needs a liver transplant, guess where he comes? From other countries. They come here, right? Because we're the best of the best. We got the most doctors. We have the most and the best hospitals. Vanderbilt, St. Thomas. Like, we get the best of the best here, especially in Middle Tennessee. And we spend the most money by a mile. So the question is, what are we getting for that? Sick, fat, sick. Where do you think we rank compared to the other industrialized nations when it comes to our health?
Bottom.
Yeah, of the top 70 industrialized nations, guess where we rank?
70.
Pretty close. We're not in the top 10. We're number 69. So on that list, we're doing better than Algeria and Mexico, which I don't even know where Algeria even is. You put that on a map, I'd never find it. Albania is beating us. Jamaica's beating us. Turkey, Belarus, Lithuania, Latvia, again, no idea where that is. Iran, Panama. So we're like third world type outcomes when it comes to our healthcare system. And we're spending all that money, taking all those medications. What is the problem? This is my theory. So this is a house that caught fire like yesterday, let's say. So the way our current healthcare system works is a lot like the fire department. So we have a fire department in town that uses 2 main tools. They have axes and they have water hoses, just like the medical system uses drugs and surgery, by and large. If you have a fire in your house, who do you call? Fire department, right? You're going to call them. They're going to kick down your front door. They're going to bash out your windows. They'll spray down your furniture and all your belongings. But if you call them on time and they do a good job, can they save the life of your house?
Yeah.
Yes. And should we be grateful for that?
Yeah.
Eternally. The question is, what's left when they're gone? It's a mess. And how much sense would it make the next day to call the fire department back in to repair the drywall and to fix the carpet and redo the paint? Or would you need a different contractor with different tools and different skills to actually get and keep the house healthy? That's the problem. We use the emergency care system, the fire department, the medical system with the drugs and the surgeries to try to keep us healthy. And that's not their job. It was never intended to be their job. They're not capable of doing that. The medical system's job is to keep you alive and to save your life. And do they do a good job of that? Mostly. Their job is not to get and keep you healthy. Whose job is that? Who's responsible for our health? We are. Do we believe that, or do we just know that's the right answer? It's our responsibility. So then who has to be the expert when it comes to your health?
We do.
We do. Raise your hand if you like that. I don't like that at all. I can't stand. I don't want to have to be the expert of my own health. I want to just go to work, watch Netflix, lay on the couch and eat popcorn and not have to be the expert. I could just trust the experts and listen to the science, do what they tell me, take the pills, and I would be healthy. But that is not the way it works. We have to be at least have to have a modicum of education when it comes to our health, and that's a lot of what tonight is all about. So the real reason this is happening, every home in America has a minimum of 2 washing machines. You've got the one for the clothes and the dishes, and then we've got the other one for the brain. We call those the idiot boxes. We got them in every room that's basically designed to keep us dumb and keep us entertained for the most part, and we usually put one in every single room of the house just to make sure that we don't miss anything. But we have those little TVs because on those TVs there's messaging, constant messaging, telling you that all you have to do for your health is just take this little pill. You've seen those drug advertisements on TV? I'm sure you've seen those, right? What's the first 20 seconds of the commercial? They're telling you all the benefits. Like you see the people laughing and they're dancing and they're having a picnic on the beach with their family and they're all healthy and happy. What's the last 30 seconds of the commercial? Side effects. Yeah, it may cause dizziness, diarrhea, constipation, cancer, early death, rectal bleeding. I saw one for, it was for hot flashes, and one of the main side effects was hot flashes. And do you know that there's no such thing as a side effect? That's a myth. It's actually a marketing and PR gimmick. There's no such thing as a side effect. It doesn't exist. Because if I give you gabapentin and it makes your feet feel better, but if I take gabapentin, it causes me to have diarrhea, same pill, what's the difference? Did the pill change, or did it just react differently to my individual chemistry and my physiology? So it's not the medication, it's what it does to the person's individual chemistry. And if we like it, we call it the benefits, and if we don't like it, we call it the side effects. It's just a beautiful PR campaign. By the way, too, if you watch the evening news tonight, I challenge you, what percentage of the commercials during the evening news are for drug advertisements? That's a good guess. It's 74%. 3/4 of the commercials during the news segment, particularly, are all for pharmaceuticals. Do you know why they do that?
They're drug pushers.
Yeah, but like, why do they spend all that money putting those commercials on TV to advertise their drugs?
So you'll go to the doctor and ask for it.
The American public is looking for the magic pill.
Looking for the pill, to ask your doctor to tell you to put you on this pill, to familiarize you with the name of the drug. Yep, but that's not it. That's not why they do that. There's a much deeper, more sinister reason. What'd you say, Herb?
The people that watch the news typically.
That's true too. Yep, because that's their target audience and for money. But again, that's not the reason. Well, I always thought that was the reason. To brainwash you, that's not the reason either.
Before you go to sleep, that's the last thing.
Right? The real reason they do that is because if they put all their commercials between the news segments, what's the likelihood that CBS News is going to run a negative story about Pfizer or about GlaxoSmithKline? So they do it to control the narrative. If you're the main advertiser, they're not going to bite the hand that feeds them. So they get to control the news stories, and it keeps all the dirty laundry that comes out about these convicted felons, namely Pfizer and Johnson & Johnson and Moderna. They're all convicted felons, by the way. They paid the most exorbitant fines in history for pushing their products, but they can keep that out of the news if they control the advertising. And do you know we're the only country that allows drug ads on TV? New Zealand does, but it's very restrictive. Like they have to be very careful. But here, it's just the Wild West. Spain doesn't do it. Britain doesn't do it. Portugal doesn't. Like, there's no other country that allows drug advertisements on television. But we do it because of all the money. There's more lobbyists for drug companies than there are congressmen. It's about 1.5 to 1. There's 1.5 lobbyists for the drug companies for every congressman on Capitol Hill, because they do it because it works. Social conditioning, they spend about $6.5 billion every year just on advertising. That's twice as much as they spend on what's called research and development. So they spend double the amount convincing you to take the drug than they spend on testing and developing the drug. Now, I don't have $6.5 billion to spend. Wish I did, but I don't, and that's why we do our advertising and marketing just like this. If we can get the information to you in a way that actually tells you the truth and doesn't cost that much money, grassroots, boots on the ground. I know it takes a long time, but this is how we do it. So the most common culprits when it comes to nerve pain, really in general, but particularly with neuropathy, is a drug called gabapentin, also known as Neurontin. Raise your hand if you've heard of that one. If you've gone to your doctor, that's probably the first thing they gave you. So what you have to know about that, there is no drug that's approved for the treatment of neuropathy. So they use anti-seizure medications off-label in the treatment of that condition. And the way it works is it slows down, it down-regulates the function of the central nervous system. So it slows down your brain so that you can't feel your feet or your hands or your nerve pain. It's basically slowing you down so your feet and hands feel better.
Dealing with the symptom.
Exactly. Just the symptom. And the bad thing, scary thing is it doesn't even stop the progression. So the whole time you're dumbing down your brain, guess what your problem's getting? Worse. And I can't fault people for taking the medications. Like, if your feet are on fire and you can't sleep and you're miserable, like, you got to do something. But it's just given to us like, you just take this pill and you'll be fine. Well, we know that's not true. And the symptoms are not the problem. Like the pain and the tingling and the numbness and the burning, those are not the problem. They're just your body's way of telling you, like, the nerves are dying. It's just the communication network. So the other one, if you get through the gabapentin, generally they'll step you up to Lyrica. That's a controlled substance, so you normally have to go up to that one. Also an anti-seizure medication that slows down your brain so that you cannot feel your feet, and again, does not stop the progression. Those are the tools in the medical toolbox when it comes to that condition. Or they'll use opioids, rarely, but they will, or they'll use antidepressants. Those are the most common. And none of those get to the root cause. So we took a picture, Suzanne took a picture of one of your cars out in the parking lot. So whoever that is, if you want to fess up, I'm kidding. It's Pennsylvania tag, so that's a dead giveaway. But anyway, that's a car that has tape all over the bumper. Like, that's ridiculous. Like, who would do that to their car? But that is exactly what we do when we take drugs. We're literally covering up the symptom, masking the problem, kicking the can down the road, hoping it's going to get better, doing nothing to actually fix the underlying problem. So if you saw the check engine light, what would you do? You stop. Well, I know what most people do. They just keep driving. Right? I'll get to that next week, right?
Whatever that would take.
Yep, put duct tape,
Black tape over
a little black tape over the, or take a ball peen hammer and like smash out the light, like fix that problem. We would never do that, right? That'd be ridiculous because that's not the problem. That's just your car's way of making you aware of the problem. And that's exactly what our symptoms are as well. So what is peripheral neuropathy? It is damage to or disease affecting nerves. That's the simplest way to put it. It's an oversimplification, but that's essentially what the condition is. Affects the toes and the feet and the legs, kind of works its way. It's peripheral neuropathy. So it starts in the periphery, toes and hands, kind of works its way up the legs, into the back, arms, and eventually up into the neck. We had a lady years ago that was starting to get it like up into her cervical spine, up into her neck, which is kind of rare, but like once it starts, it always progresses and kind of moves inward and upward. One of the most common chronic diseases in the U.S., so it's about 9% of the entire population, or 30 million Americans, and it's roughly 30% of people over the age of 65, about 28%. So it's an astonishing number of people in this country that deal with it. And they have no solutions. They're just told that you're just going to have to live with it or it's going to get worse. And only about 30% of the actual diagnoses are directly linked to diabetes. So I used to think, before we started doing this, I thought that if you had neuropathy, that was because you were diabetic. Like they only kind of came together. But it's only about a third of the cases are directly from diabetes. It's a big chunk, but it's not the whole thing. The 7 most common warning signs are things like numbness. Again, that's the marshmallow under the foot, or the sock is balled up underneath the shoe, or you feel the tight band around the toes. Burning pain, and that could be hot or cold feet. The same nerve does both sensations, so you can get hot feet or cold feet. Cramping, they get those Charlie horses in the legs or in the calves. Some people have like restless leg syndrome that comes from that. Sharp stabbing or electrical pain. The prickling and tingling, like the pins and needles, can be part of it. Balance problems and falls, and then issues with sleep. So those are the most common, not all. And how many symptoms you have of that list doesn't typically indicate how bad the problem is. We've seen some very advanced cases that all they really had was a little bit of numbness. Or we've seen some early cases that had almost every one of those on the list, but really their scans weren't all that bad. So it's not an indicator of severity. The best way to visualize, like a household cord, if you picture that nerve as running down into the leg, into the feet, that household cord or the nerve has a covering on the outside that's made out of insulation. We call that myelin. And it's actually made out of cholesterol. So cholesterol is the primary ingredient in the covering around your nerves, which is why when we see patients initially, we typically will ask them, are you on a statin medication? You ever heard of statin drugs? Those are your cholesterol-lowering drugs, most widely prescribed medication on the face of earth. Because what that does, that medication stops your liver from producing cholesterol, which cholesterol is just a building material. It's not harmful. It's not the boogeyman that everybody's made it out to be. It's really just a construction material. The reason they use it for cardiovascular disease is because if the arterial wall, if this is the inside of your artery wall, when we have inflammatory lifestyles with toxins and sugars and grains and bad food, that lifestyle basically takes a chunk out of the drywall. Well, what do you think your body uses to repair the inside of that artery? It's using cholesterol. So it's using that to patch that up. So the cholesterol is not a problem. It's when the cholesterol becomes oxidized. That's a whole other ball game. So generally we have to have the conversation with people like, if you're going to try to get well from this, you're probably going to have to push pause on the statin medication because you're just not going to have enough raw material to repair the nerve. And by the way, too, with cholesterol medications, if you're on those for what's called primary prevention, I could spend an hour on this, but I'm going to spend 30 more seconds. If you're taking statins for what's called primary prevention, which means you're trying to prevent your first heart attack, your first stroke, your first cardiovascular event, you're going to get about a 1% reduction in having those events. Now, if you're taking it after you've had a stroke or after you've had stents or after you've had a heart attack, then your benefit is more like 30%. But for primary prevention, you get about a 1% benefit. And the increase in mortality from being on a statin drug for your life is about 4 days. So if you're on that drug every day for years and years, you're going to get about a 4-day increase in your life expectancy. Now, those could be 4 very good days. I don't know. Those could be amazing days. Who knows? But it's 4 days. And then you're dealing with having to take a pill every day, and you're dealing with all the side effects, quote unquote. And we're seeing an increase in Alzheimer's and dementia in people that are on statin drugs for many, many years, because guess what your brain is made out of? Myelin, which is primarily made of cholesterol. So we're killing our brains to try to keep our heart healthy. And one of the main side effects of statin medication is a thing called rhabdomyolysis. Anyone ever heard of that? It's a breakdown of muscle tissue. What's your heart made out of? Muscle. So we're going to potentially damage the muscle we're trying to protect by lowering the cholesterol with the statin medication. Do your research. If you're on the medication, you got to be educated on what it does. And plus, by the way, too, there's a lot of other options like slow-release niacin and red yeast rice and omega-3 fish oils and a low-carbohydrate, low-sugar diet. Much more effective at lowering the cholesterol with no side effects. There's other strategies. So some of the main causes of peripheral neuropathy, you have diabetes, prediabetes, really metabolic syndrome is probably the main driver that leads to those things. Metabolic syndrome, by the way, there was a study done in 2018, University of North Carolina, Chapel Hill, where they found that 12% of people have healthy metabolisms in the United States.
What?
88% of people in America have metabolic syndrome. That's men, women, and children. 88%, basically 9 out of 10 people has a broken, dysfunctional metabolism that primarily can only use glucose for fuel and has a very low capacity of using fat for fuel. So that's one of the things, if you're going to turn this around, we'll talk about it more in a minute, is we have to get your body more metabolically flexible where it can use fat for fuel and you're not just burning sugar all day long. Because if you're burning sugar, guess what you're craving? Sugar. You're craving the fuel. Poor circulation, toxic exposure, things like chemotherapy. I'll tell you, those are probably the most complicated cases that we typically see, are people that had no neuropathy, they went through chemo, and then their neuropathy started during or right after they had the chemo, because it just does so much destruction to the nerves. And those cases largely will get better, but usually to a point. Like there's a limiting factor there with most of those cases. Back and neck issues from herniated discs and spinal stenosis. The reason that's so important is because the nerves that leave your neck, the brain sends messages down your spinal cord, out the nerves of your neck into your arms and fingers, and the nerves from your spinal cord that run down out of the lower back go all the way down into your feet. So if I cut the nerve in your lower back, guess what happens to your foot? It's dead. Instead of cutting the nerve, what if I put pressure on the nerve, or your spine was out of alignment, or you had stenosis or arthritis or degeneration, and it's choking the nerve in your lower back? Guess what's happening to those nerves in the feet over time? And the other piece of this that we don't realize, the same nerve that runs down your back of your leg and butt into your foot is the same nerve that controls your bowels, bladder, prostate, and reproductive organs. And the same nerve that leaves your neck and runs into your arm is the same nerve that controls your heart and your lungs. That's why when people have a heart attack, they'll feel their neck and their arm, because the same nerve is doing both jobs. So how important is it to keep your spine in good alignment and functioning properly? It's not about stiff necks and sore backs. It's about keeping your body functioning the way it's designed. Because your body's designed to be healthy. If you cut your finger, it's going to heal. Anyone ever had a paper cut? Anyone walking around with a paper cut from the Reagan administration? No, because it heals, right? Sometimes or always. Always. It always heals. You don't have to put Neosporin or pray over it or put a Band-Aid. The body's going to heal itself. So the thing you got to know is, like, Band-Aids don't heal you, chiropractic adjustments don't heal you, drugs don't heal you, surgeries don't heal you, and acupuncture needles don't heal you. Your body's the one that heals itself. Now, drugs and surgery, adjustments, needles, those things can facilitate the healing process, but healing is actually an inside job. It's not from the outside in, it's from the inside out. Autoimmune diseases, infections, alcohol abuse, liver, kidney, thyroid conditions. Especially with women, we have to evaluate, like, what's your thyroid history, because chronic thyroid hypothyroidism or Hashimoto's can lead to neuropathy. And then being on several medications. You know, that little, when you get the prescription, that little sheet that they staple, that little booklet, basically, that they staple to the bag that nobody ever reads. They just tear it off and throw it away. If you read the fine print of those medications, a lot of the side effects can actually be neuropathy. And by the way, too, if you're taking multiple medications, those things aren't tested together. So you take drug A and drug B, you're actually taking drug C, D, F, Q, X, Y, Z. Like, it's not, they don't test them individually. And by the way, too, the FDA gets 44% of their annual budget directly from the drug companies. Half of their operating budget comes from the companies that they're supposed to be policing. So is it any wonder why there's so much corruption in that system? So here's some of the nerdy science. So if you were to take that household cord and cut it open and spread out all the fibers, there's 7 different fibers primarily that we're concerned about when it comes to neuropathy. There's A alpha, beta, gamma, B and C fibers, and they all have different jobs and different functions. The large fibers, your A alpha, are the ones that control balance and what's called proprioception. So if you were to close your eyes, stand on one foot, touch your nose, those nerves, the big, large A alpha fibers, are the ones that your brain uses to communicate where you're at in space. As those become damaged, we have issues with falls. And it's about 1 out of 3 adults every year over the age of 65 falls every year. And 20 to 30% of those are moderate to severe. 10% of those falls are considered fatal. And that doesn't mean that you died on impact. You ever heard broke your hip, died of pneumonia? Heard of that? Yeah, because when you break your hip and you're bedridden, then fluid accumulates in the lungs. So it's something that the fall led to that person's demise. It's a leading cause of injury death in people over the age of 65. So it's really a big issue. It's not just I'm embarrassed because I fell down at Walmart. I mean, it's a major health risk. These smaller fibers, the B and C fibers, when those become deteriorated, it leads to amputation because now you have no function in the feet. 86,000 of those happens every year in the United States. People are obviously lost with hopelessness and losing a limb and losing their mobility. And by the way, too, I don't like this slide because it kind of looks kind of like a scare tactic in a way. But who do we never think that's going to happen to? Yeah, that's not going to happen to me. I'll deal with that when it gets there. That's going to be somebody else until it does, and then we're faced with the reality of it. So this is from another event, a friend of mine that does events like this. He was doing a neuropathy seminar at a restaurant, and a lady that was coming to the restaurant to learn about neuropathy, she hit the gas pedal instead of the brake, and she ran her car into the front window of the restaurant that she was going to learn about peripheral neuropathy, which is kind of nobody was injured, so you can laugh. But you know, it's kind of ironic that that's where that happened, right? And what do you think happened to her driver's license? It's gone, right? So now she can't drive, can't go see her grandkids, she can't go get her hair done, can't go to church, has to be cared for. People have to drive her around because she can't care for herself. So the choices when it comes to this, first choice is to do nothing. That's an option. I mean, this is not communist China yet, so you can still do nothing if you choose to do nothing. But any chronic degenerative condition that we do nothing about is going to get what? Worse. That's the one thing we know for sure about a chronic degenerative condition is if we do nothing, then it's absolutely going to get worse. You go to the doctor and get your primary care doc and get drugs to mask the symptoms or get referred to the neurologist. That's the common top 3 options. Has anyone been to the neurologist before? You guys have been there? Dave's had an experience. The typical neurology appointment, they're going to do nerve testing. It's called a needle EMG. That's a peach of a test, by the way, if you've ever had that one done. Never had the pleasure. They take needles and they stick them into your nerves up and down your legs, and the machine makes a screeching noise, and they want to find out if you have neuropathy. Well, you probably already knew that. Like by the time you got into that setting, you already knew that you had neuropathy because your primary care doctor sent you to the neurologist. So it really gives very little useful information. And remember those 7 nerve fibers? That needle EMG is testing 2 of those. So you're not even getting a wide picture of the condition. And then more medications. Those are the options in the neurological world. Most people have been told there's nothing you can do about it. You're just going to have to learn to live with it. Get a 1-story house. Like get rid of your basement and your upstairs, or you know, get a walker or a wheelchair, or just you know have somebody drive you around. Like that's the sadness in this is it really leaves people with kind of a hopeless, like this is just going to be my life. I'm not going to be able to do anything that I care to do. Living with it leads to surgeries, walkers, wheelchairs, 4-prong canes, more medication. But again, who do we never think that's going to happen to? Like, that'll be somebody else. That's not going to happen to me. Doing the same thing over and over and expecting different results. Insanity. Remember who that quote is attributed to? Does anybody know? Einstein. Yeah, you're right. Pretty smart fella. Yeah, so that's, you know, I think part of us is like if we just keep taking the medication, maybe if I just keep taking it long enough, maybe that's just going to eventually solve the problem. But we know that inherently we know that that's not going to be the cure. So we spent the first 30 minutes, 40 minutes depressing you. So here's the good news. According to the NIH, and you can say what you want about Dr. Fauci's organization, how he's not in prison. I have no idea, but I digress. Peripheral nerves have the ability to regenerate as long as the underlying nerve cell hasn't died. So as long as there's life in the nerve, if we do the right things, and we'll show you what that looks like, then the nerve can actually repair and regenerate as long as once the nerve cell is dead, it's dead. There's no coming back from that. So this is kind of how this looks. So the top nerve would be a healthy nerve. So you notice it's got that yellowish orange covering. That's the myelin, which is made out of cholesterol. That's the insulation around the nerves. And then it's got those red, looks like vines growing through it. Those are the blood vessels. So the blood vessels are carrying the oxygen, the nutrients, and the vitamins, and everything to keep the nerve healthy travels through the blood supply. How do you think those people's feet feel at the top? Great. They don't even appreciate their feet. It's like they don't even barely know they even have feet. When you get to that moderate stage, you start to lose some of the blood supply. The nerve begins to deteriorate, and that's where we get things like pain or numbness or tingling or burning or cramping or cold feet, restless leg, balance starts to get a little wobbly. That happens in that moderate stage. The severe stage, or the third one, is where we're having like lots of falls, having to use a cane or a walker, a wheelchair, stronger pain medications, Lyrica, opioids, and then that final stage is amputation. Now the scary thing with this is it can take decades to go from normal to that moderate stage, like literally 10, 20, 40 years to go from 1 to 2, but to go from 2 to 3 to 4, sometimes that's a pretty steep slope. Like it's always on a downward trajectory. We just don't know how steep that slope is. The 4 key steps to feeling better. This is kind of the secret sauce of how you turn this condition around. You have to rejuvenate you have to increase blood flow to the nerves, to the areas where the nerves are damaged. You have to get more blood flow to the nerves, and we'll show you how we do that. You have to stimulate the nerves, and that really is in a way that causes them to repair and regenerate. So it's got to be on a certain frequency with certain types of equipment, activate through certain types of therapy, and we have to empower by decreasing inflammation. And that's one of the keys to this whole puzzle is we got to get the inflammation down, because if you don't have the conditions to heal, your body's not going to be able to do its job. Do you guys know what the #1 cause of inflammation is for most people?
Sugar.
Sugar, yeah, it's our diet, right? The way we kind of frame this so it's easy to remember, if we're going to reduce inflammation, we have to turn off our GPS. And some of you that have heard me speak before, I usually say this in almost every talk I do. You have to turn off your GPS, because if you're eating foods out of the G, P, and S category, then your GPS is set for inflammation and neuropathy and cancer and heart disease and diabetes and Alzheimer's and dementia. Do you guys know what they're calling Alzheimer's and dementia now?
Type 3 diabetes.
Type 3 diabetes. Because the same metabolic dysfunction that leads to regular diabetes also leads to cognitive decline.
That was true for my mother.
Yep, that's almost every case. So the G, the category of food that starts with G that we have to minimize, reduce, or hopefully eliminate or get a handle on, what do you think that stands for, the G? Grains. Grains, really mostly the processed grains, but initially with this program, it's better to do no grains at all. And grains are your bread, pasta, cereal, crackers, chips, pretzels, cookies, bagels, muffins, pastries, corn chips. Here's some groans. Have a good night. Thank you. So all those grains, things that come in boxes and bags, the chips and crackers, all those things are processed grains. And the main thing is, when we eat those, how quickly do they turn into mush?
Pretty thin.
Like immediately. And that mush is sugar. So the amylase in your saliva basically breaks that starchy carbohydrate down into glucose. It breaks it down into sugar before it even gets down in your throat. You guys ever heard of the glycemic index?
Yeah.
Heard of that? What's higher on the glycemic index, like which turns to sugar quicker, a piece of whole wheat bread or a Snickers bar?
Whole wheat bread.
Whole wheat bread. I'm not advocating Snickers bars, but as an example, whole wheat bread turns to sugar faster than a Snickers bar turns to sugar. What about white bread and table sugar? Which one's higher?
White bread.
White bread. White bread turns to sugar faster than table sugar turns to sugar.
Scary.
You can look that up, you Google it, it's easy to find. and we consume these things. So in the morning we have our Honey Nut Cheerios with our milk, and then for lunch we have our sandwich with our chips, and then for dinner we have a big old bowl of pasta or a pizza or a hamburger or a hot dog or whatever. Most people that I meet, they eat like an 8-year-old with a credit card. Like literally how an 8-year-old would eat if they had unlimited funds and had a credit card. So we're trying to get away from like breakfast cereals and waffles and biscuits and hash browns and all the other good, yummy Southern stuff, and moving toward like a savory breakfast, which is like eggs, turkey bacon. Can I get an amen for eggs and butter?
Amen.
Yeah, right. It's good for you. Like, eat it. If your great-grandmother used to eat it, you eat it. If your great-grandmother didn't even know how to pronounce it or never even seen it in her life, don't eat it. It's really that simple. Really that simple. And then for lunch, we're doing like, a salad with grilled chicken or meat and veggies. And for dinner, we do like a steak and asparagus and some broccoli or whatever. And then every night before bed, I eat chocolate and ice cream.
Yummy.
I do, every night.
Don't eat margarine.
And nobody's asking me how. Okay, so dark chocolate, so preferably dark. At 60%, 72% is better. Darker the better. It's got it just loaded with antioxidants, and it's very healthy, anti-inflammatory. And then for ice cream, I'll make a smoothie, like the protein powder that we carry, with some berries, maybe a little bit of unsweetened almond milk, blend it up with some cinnamon and throw some other stuff in there, and then I eat it like ice cream. So every night, I'm basically eating chocolate and ice cream before bed.
Sugar-free.
Yeah, for the most. There's a little bit in the berries or whatever. So that's the grains. The P, you know what the P stands for that we're going to avoid? Processed. Processed food is obvious, right? Like if you get your food from a bag that's handed to you through a window, it's probably not going to be good 99% of the time. Processed seed oils are really the biggie, the ones that contain what's called linoleic acid. So your sunflower oil and your corn oil and your vegetable oil and your safflower oil and your peanut oil, and really the biggie is canola oil. Anyone ever heard that canola is healthy for you? I used to think that was like the best oil you could eat. The American Heart Association has their little label right on the side of the bottle. Do you know where canola oil comes from?
There's no such thing as a canola plant.
Yeah, it doesn't exist. She said there's no such thing as a canola plant, and that's true. But they put that little weird-looking ear of corn on the side of the bottle. It's genetically modified rapeseed oil, which sounds horrific enough, but they take rape seeds, which are completely inedible, and they run them through a machine, and they produce this nasty sludge that's so toxic and stinky, they have to deodorize it with hexane, which is actually a carcinogen, and then they have to put it through with ethanol and process. So by the time it makes it to your grocery store shelf, it's completely oxidized, it's omega-6, rancid, highly inflammatory. But my cardiologist said, get rid of the butter and start eating canola oil. Well, your cardiologist doesn't know what he's talking about. I'm sorry, but that's the reality. So for oils, we want to try to use at high temperatures. What do you think the best ones are? That's lower temperatures. Yeah, olive oil has a pretty low flash temperature.
Coconut oil.
Grapeseed oil is okay.
Coconut.
Coconut. Yeah, I've kind of moved away from grapeseed. I used to think that was one of the better ones, but the data just doesn't really look that great. So I like avocado oil and coconut at high temperatures. Very high flash temps. You can cook them to death. They don't become rancid. And at lower temperatures, you want your olive oil and starts with a B. Butter. Good old-fashioned butter. Get an amen for butter, right? So those are your ideal oils.
Stay away from margarine.
And stay away from margarine. I can't believe it's not butter. What is it? Here's a test. So take a scoop of butter and take a scoop of, I can't believe it's not butter, or margarine, put it on a plate, stick it outside, and see which one the ants will eat. They will not touch the margarine. They are smarter than we are. Like they'll devour the butter, but they will not touch the margarine because they're more in tune with nature and God than we are because we're idiots. And then the S. So the G is the grains, the P is the processed seed oils and processed food. What does the S stand for? Sugar. No, strawberries. No, I'm kidding. I'm joking. Sugar. Yeah, sugar. Good old-fashioned sugar. As much as we can avoid. We eat 10 times the amount of sugar per person than we did 100 years ago. We used to eat about 7, 8, 10 pounds. Now we're eating about 110 or 115, 120 pounds of sugar per person per year in the United States. Well, I guess diabetes just must be genetic. I guess I just have bad genes. Is it that, or is it all the massive tons of sugar that we're consuming and processed seed oils? And by the way, too, your genes, our genetics have changed 0.04% in the last 10,000 years. Almost none. Your genetics haven't changed. We're still hunter-gatherers. Do you realize that? Genetically, we're still hunter-gatherers. We're supposed to be killing our food and then cooking it and then eating it and having to go hunt for it again the next day. But we don't hunt or gather. We shop online and we use DoorDash, right? And use drive-through windows. It's like we live in this super comfortable, easy society where we never, there's a great book called The Comfort Crisis. I highly recommend you guys read that. Dr. Michael Easter, The Comfort Crisis. And his whole theory is we're still hunter-gatherers, but we live these ultra comfortable lives where we get up in our nice warm bed, take our nice warm shower and drink our nice warm cup of coffee, and then we drive our air-conditioned car to our air-conditioned office and we stare at our computer screen and then drive home and then we watch Netflix. We're never exposed to extremes of heat or cold or hunger or thirst. We never sweat. We don't exert. We do nothing. Imagine if you took a monkey from the jungle and you gave him like a Franklin lifestyle. Like you gave him a Frappuccino for breakfast, you gave him like a Five Guys cheeseburger and fries for lunch, and he never got any exercise. He stared at a computer all day, and basically, would his health get healthier? Would his health get healthier, or would he get healthier or sicker?
Just die.
Yeah. How many times out of 1,000 would he get sicker? 1,000, right? And then what would the solution be? You're going to give him some medication for his depression, maybe give him some Celebrex for his back pain, maybe give him some sleeping pills because he's not sleeping good at night. Like that would make no sense for an animal, but it's the exact thing we do as humans. And then we feed our kids worse than we feed our animals. No, Timmy, don't give that soda and chips to the dog. That's for you and your friends. Like what? And that's exactly what we do, to the point that we giggle about it, but we're really murdering our generation of children. So turn off the GPS, and that may sound harsh. It's probably harsh to hear that, but it's not harsh for me to say that, because I can show you the data that will knock you out of your chair that the foods we give our children are 100% killing them. ADD, ADHD, learning disabilities, tics, narcolepsy, you just name it. Go across the board. The things we're doing to our bodies is what's causing these issues. So how do we increase blood flow? Number one is through red light therapy. Some of you have heard of that, or some of you guys own that unit. But red light therapy, we use two different wavelengths, 660 and 880, and those are designed to penetrate at different depths to actually stimulate a process called angiogenesis. It's not important that you know that. It just makes me sound smarter. But it's your body producing more blood vessels. And we do that around the areas of those damaged nerves. And then light therapy was introduced by NASA, speeds up healing, reduced pain, cellular regeneration increased, promoted new blood vessel growth, and it decreased the overall time of healing. So that's very well documented. We use a machine called a Hacomed. Have you ever heard of a Hacomed? Some of you guys have. I think we're one of maybe two people in Middle Tennessee that actually own that. It comes from Germany. And you guys have heard of a TENS machine, right? Like a TENS unit. Those things cost like $80. The one that we have in office is $40,000. And the reason we invested that is because that's what it takes to actually repair those damaged nerves. So it's like comparing a Ferrari to a bike. Both can kind of get you going down the road, but it's a little different experience based on what you're in. 2,000 references for light and electrical therapy. So if you go to like PubMed and you put in light therapy and neuropathy, or you put in electrical therapy and neuropathy, you'll find a list a mile long of medically indexed references for these therapies. So the question, like, why does my doctor not know about this? And the answer to that is I really don't know. I've got an amazing neighbor who's a doctor, and we were talking in the yard one day about like neuropathy, and he sees a lot of neuropathy. He said, I can't stand neuropathy cases. He's like, I love the people, they're sweet people, but they come in and I give them the gabapentin, and they come back 6 months later and I give them more and I give them more, and I was like, well, Tony, like we do all this stuff, like we have all these options, but I think that's just part of the training, because really it's not the doctors that are the problem. It's the boardroom of the pharmaceutical companies where the problem is. It's not the nurses, it's the C-suite of the hospital administration rooms where all the real decisions and the protocols are made. That's where the problem is. It's not the doctors and nurses, they're just stuck in a broken system. So we use PEMF, we use red light therapy, laser, class 4 laser therapy, shock wave, and that's the Hockamed on the bottom. There's some other things too, but that's the primary tools in the toolbox for trying to get that condition under control. So if you imagine for a moment sleeping peacefully through the night without pain, not kicking your spouse, walking confidently and feeling steady again, taking trips and enjoying family outings, and then feeling like you're 10 years younger. And the reason that happens is because when you follow those 4 steps to regenerate the nerves and to restore the blood flow and to activate through therapy and you reduce the inflammation, your body's going to get healthier from the inside out. It's not about treating your feet, it's about getting your body healthier. So the big question is like, why do you want to feel better? And for a lot of people, because when people come in, I'll usually ask them tell me why you're here, and they'll say, my feet are burning. And I'll say, well, tell me why that's a problem. And they'll say, well, because when my feet are burning, I don't sleep good at night. I'll say, tell me why that's a problem. And they say, well, because when feet are on fire and I'm not sleeping at night, I don't have any energy and I can't work and I'm mean to my spouse. I'm like, bingo. That's why you're here. We don't go to doctors because of our pain. We go because of what it's keeping us from being able to do in our life. That's the real driver for most people. My wife, some of you guys know this story, but my wife was, so we had my daughter who's now 17, and then about a year later we got pregnant, almost boom, boom, boom. And then really from the start of that pregnancy, my wife's health started tanking. She was diagnosed with a condition called POTS. Has anyone ever heard of POTS? P-O-T-S. Stands for sucks. It's postural orthostatic tachycardia syndrome. So it's like having horrible chronic fatigue and fibromyalgia and shortness of breath and migraines and dizziness, and it's just like 15 things kind of rolled into one. So in the second half of that pregnancy, we ended up losing our daughter in the second half of that pregnancy. And then for about 2 years, a little over 2 years after losing our daughter, she was bedridden. Almost complete, not completely bedridden, but she never drove her car. We didn't go to movies or to church or travel. We didn't do anything. So, and by the way too, we took her to Vanderbilt, which is considered the experts in POTS. They have an autonomic clinic there that people from all over the world come to that clinic. And they went to that clinic, we did the testing, they gave her a drug which didn't work, and then they gave her another drug which actually made her worse, and they put her on, so that didn't work, so now they put her on an antidepressant. Because if we can't fix your problem, you must be crazy, is really the message that we got. So she got down to 5'8" and a half, she got down to about 95 pounds. So I was watching her die, is really what it was. Do you think when she was sick, I really cared about my watch or what football game was on TV or what kind of car I was driving or what kind of vacation? What do you think the only thing we cared about was? Her health. Because when you get sick or when someone you love gets sick or they lose their health or they can't function the way they want to, your whole priority list gets completely inverted. The things I used to think that mattered so much and were so important, and I just could care nothing about that stuff. It's all about your health and getting it back and helping her get healthy. So our health is really, what's the saying, a healthy man has 1,000 wishes and a sick man has one? That is so, so true. Because when you lose your health, there's no links you wouldn't go. And we went to Atlanta 4 times, we went to Dallas twice, we went to Florida. We went all over the country trying to find ways to get her well, and it was only when we started implementing some of these systems and actually giving her body the chance to heal from the inside out that she actually was able to regain her health. And now she's probably 85% better. I mean, we've got a 3-year-old, so some days it's 20%. And it kind of fluctuates based on him. But she's better because we actually got to the root cause. Your body's designed to be healthy if we do what's right. So for most people, the reason they want to get healthy is not about them. It's really about their family, grandkids, traveling, playing golf, playing tennis, being able to work in the yard, being able to drive myself around and not be having to have to be cared for. That's most people's driver for why they want to be healthy. So what do we do from here? Who should come and see us or get checked out? If you've got one of the 7 symptoms like the numbness, the burning, the cramping, the sharp stabbing, prickling, tingling, balance problems and falls, issues with sleep, those are the most common symptoms. Those are the ones that we typically see. The next steps is you reserve your spot, get a consultation, and then we perform an evaluation, and then we recommend a treatment plan. That's kind of how this works. If you're a guest and you're wanting to get checked out, that's kind of how this works. We do a 36-point Advanced Neurological Qualifying Assessment. So we do a thermal imaging scan to check the blood flow, to see how much blood flow is getting to the feet or the hands. And then we do x-rays if needed, and then we do about 30 other tests to figure out exactly which of those 7 nerves is damaged and by how much, and then what settings you need on the machines and kind of how to program your care to help. We ask you to bring the person closest to you. A couple reasons for that is health is it's a family affair, and I want to get from the spouse or from the loved one or the friend like what they've experienced with you too, especially with like when I see men and their wives come with them. I'll ask him, I'll say, well, how do you do at night? And he'll say, well, I'm fine, I sleep like a baby. And she's like, no, you don't, you're kicking me all night long. So it's good to have like both ends of that spectrum. And then also too, I want them to know exactly how bad or how not bad the condition is, so that everybody's on the same page. Normal pricing, if we did this in a hospital, if they did all those tests in a hospital, which they do not, but if they did, how much do you think all that would cost?
If they did it in a hospital, our insurance would cover it.
Hopefully. 20 grand. Right, 20 grand, right. And the cost for this typically is $249 if it's like the walk-in price for people that aren't currently patients or at these events. And if we're here today, we do it for $89. And the reason we discount the pricing is because this saves us a lot of time doing it this way. So we've explained a lot of what we do and how we get in this situation. So it saves us time. Who should not come in is if you're not serious about getting better, if you're not willing to do what it takes to get healthy, because we want people that are willing and able to get the program going and do what they got to do to get well. Just came for a free dinner. We call those plate lickers. I had one guy that came to like 6 of my dinners. He just figured out I'm coming to a free dinner. So anyway, that's joking. If you are here for a free dinner, we're glad to have you. Hope you get some good fellowship. Free dinner's on us. And then if $89 is a stretch, if you can schedule the appointment within 8 days, we drop it to $39. And that reason is because we kind of block our schedule after these events to have a tighter schedule. Neuropathy is progressive and degenerative, gets worse over time. Obvious, I mean, we know that. So, yeah, guys, that is the conclusion of the talk. So, thank you.